Terri Schiavo's case, Ethics of End-of-Life Decisions Without Advance Directives. Introduction. The Terri Schiavo case remains one of the most publicized and controversial bioethical issues in modern times. The case revolved around Teresa Marie Terri Schiavo, a woman who suffered a cardiac arrest in 1990, leading to severe brain damage and a persistent vegetative state. The primary stakeholders in this case were Terri Schiavo, her husband, Michael Schiavo, her parents, Robert and Mary Schindler, the healthcare professionals involved in her care, and the legal system. The bioethical issue at the heart of the case was the right to die and the role of advance directives in making end-of-life decisions. The case spanned from the early 1990s until Terri Schiavo died in 2005, and it involved numerous court battles, public debates, and media scrutiny. Bioethical analysis. The bioethical issue in the Terri Schiavo case was the ethical dilemma of whether to continue life-sustaining treatment for a person in a persistent vegetative state with no hope of recovery. Central to this issue was the concept of self-determination, the right of individuals to make decisions about their medical care, including the refusal of treatment. In Terri Schiavo's situation, the controversy arose because she had not left a written advance directive outlining her wishes regarding life-sustaining treatment. This lack of explicit instruction led to a dispute between her husband, who claimed that Terri would not have wanted to live in such a condition, and her parents, who argued that their daughter would have chosen to continue treatment. The role of advance directives, such as living wills or healthcare proxies, is to provide clear instructions for healthcare professionals and family members to follow when a patient is unable to communicate their preferences. In the absence of such directives, healthcare professionals and the courts must often interpret the patient's wishes based on testimony from family members and other evidence. The Schiavo case highlighted the critical importance of advance directives in avoiding protracted legal disputes and ensuring that a patient's autonomy is respected. Healthcare professionals were placed in a difficult position, needing to balance the ethical principles of not harming, non-maleficence, promoting the patient's well-being, beneficence, and respecting the autonomy and wishes of the patient. The bioethical issue in the Terri Schiavo case significantly influenced the decisions made by healthcare professionals. The lack of a clear advance directive forced healthcare providers to navigate the conflicting wishes of family members and the legal system. The case underscored the need for clear communication and documentation of patients' wishes regarding end-of-life care. It also caused healthcare professionals to reflect on their ethical obligations, weighing the need to respect patient autonomy against the potential for causing harm by either prolonging life or hastening death without clear evidence of the patient's wishes. Healthcare professionals were tasked with the responsibility to care for Terri following the legal decisions made by the court, which ultimately sided with her husband's assertion of her presumed wishes. This decision was based on the principle of substituted judgment, where a surrogate decision-maker attempts to establish what the patient would have decided if competent to do so. Conclusion. The Terri Schiavo case serves as a poignant reminder of the complex and emotionally charged nature of end-of-life care. It highlights the vital role healthcare professionals play in advocating for their patients' rights and the importance of advanced care planning. The case has prompted many individuals to create advance directives and has spurred discussions within the healthcare community about the ethical considerations surrounding end-of-life care.